Capitalist healthcare systems are often characterized by their focus on profit over people. In such systems, access to healthcare is largely determined by one's ability to pay, which can lead to significant inequalities in health outcomes. The commodification of healthcare turns a basic human need into a product, accessible only to those who can afford it, while leaving the most vulnerable populations at risk. The primary issue in capitalist healthcare is the profit motive. Hospitals, pharmaceutical companies, insurance companies, and even some healthcare professionals are driven by the need to generate revenue. This can lead to practices that prioritize profit over patient care, such as overcharging for services, taking money away from being used in healthcare into the pockets of private companies and managers, prioritizing lucrative treatments over necessary ones, or denying coverage for essential care. With capitalist healthcare, access to quality care is often a reflection of one's socio-economic status. Those with wealth can afford the best treatments, often receiving care at private, well-equipped facilities, while the poor may be relegated to underfunded public hospitals or left without care altogether. This leads to stark disparities in health outcomes, with marginalised communities often facing higher rates of morbidity and mortality. The pharmaceutical industry in a capitalist system often prioritises the development and marketing of drugs that promise the highest returns rather than those that address the most pressing health needs. Life-saving medications can be exorbitantly priced, putting them out of reach for many who need them. The focus on profits can also stifle innovation, as companies may avoid developing treatments for diseases that affect smaller or poorer populations. The profit-driven nature of capitalist healthcare creates a complex web of privatization, insurance policies, billing practices, and administrative overhead that often serves to obscure costs and inflate prices. Patients can find themselves overwhelmed by medical bills, unclear pricing, and denied claims, all of which contribute to the financialization of healthcare. In a capitalist system, healthcare is treated as a commodity, something to be bought and sold, rather than a basic human entitlement or need, and private corporations and managers are given control over healthcare, and they take vast amounts of money for themselves that could be put to vital use for patients and staff. Healthcare as a commodity inherently leads to exclusions and disparities, as not everyone can afford to buy into the system. The commodification of healthcare also leads to moral and ethical dilemmas, as the ability to receive care becomes contingent upon financial means rather than need. In contrast, anarchist approaches to healthcare advocate for structures that are decentralized, community-based, and prioritize human needs over profit. Anarchist healthcare models aim to remove the power dynamics and hierarchies that are inherent in capitalist systems, promoting equality and accessibility for all. Anarchist healthcare would be organised through decentralised networks of clinics, cooperatives, and community-based organisations. These networks would be managed by the community members themselves, with decisions made horizontally. By decentralising healthcare, the system becomes more responsive to the specific needs of different communities and individuals rather than being controlled by distant profit-driven entities. With anarchist healthcare, community and individual control is paramount. Local communities and individuals would have the autonomy to establish and manage their own healthcare resources, ensuring that care is tailored to their specific needs. This participatory approach would foster a sense of ownership and responsibility among community members, encouraging them to take an active role in their health and the health of others. Anarchist healthcare emphasizes mutual aid and solidarity, where individuals and communities work together to meet each other's health needs. This could take the form of health cooperatives, where members contribute, or working to ensure that everyone has access to care. The focus on mutual aid rejects the commodification of healthcare. Anarchist approaches to healthcare would prioritize holistic and preventative care, addressing not only the physical aspects of health, but also the social, environmental, and psychological factors that contribute to well-being. By focusing on prevention and addressing the root causes of illness, anarchist healthcare structures aim to reduce the overall burden of disease and illness, etc., and promote long-term health. Anarchist healthcare would be accessible to all, regardless of socio-economic status, race, gender, or any other identity marker. Inclusivity would be a core principle, ensuring that marginalised groups receive equal care. Anarchist healthcare would also be free at the point of use, removing financial barriers to access. Anarchist healthcare would also involve healthcare workers in the management and operation of their workplaces, ensuring that they have control over their working conditions and are able to make decisions about patient care without the interference of profit-driven administrators. This would lead to more ethical and equal healthcare structures where the well-being of patients and workers is prioritised. The capitalist model of healthcare, with its focus on profit and perpetuation of inequality, falls short in providing equal accessible care for all. Anarchist alternatives offer a vision of healthcare that is decentralized, community controlled, based on individual autonomy, and rooted in mutual aid and solidarity. By removing the profit motive and empowering communities and individuals to take charge of their health, anarchist healthcare structures aim to create a more just and humane approach to medicine, where the focus is on caring for people, not generating profits. Thank you for listening, everyone. All the best.